I was working all the time. I didn't have time for my friends anymore. I didn't have time to have fun. So I realized right away that this is what I'm gonna be doing for the rest of my life. I had to adjust accordingly. So I tell you that stories because I think that's very similar to what's happening in value-based care. A lot of primary care practices, specifically, if you're a primary care doctor or doctor in general looking to understand value-based care, hopefully this primer will help you. We're going to discuss value-based care and how it's changing healthcare, but more specifically, how it can benefit you and your practice. Value-based contracting is complex, but it means a lot of things to a lot of different people and can be very complicated. I had the recent opportunity to talk to several different of my practices, all the things that they're doing when it comes to value-based care. It is very complicated. And so before I get into it, I'd like to tell a story. I can remember being younger and wanting to one day have a job. I told my dad, I want this job because I want to have my own money. I want to do my own thing, right? And I was around that age when it was time to get a job. I went around looking for different people that were looking to hire someone around 15, 16 years of age so I could get a job. And I was looking everywhere. I was like, I really want this because I felt like I wanted the money to do other things with it, right? I felt like I didn't want to get allowance all the time from my parents. I wanted to make my own money based on what value I bring to that company. I looked everywhere and found the perfect job. I was going to be a grocer bagger for a large grocery chain. They're no longer around anymore. I said, hey, I'm going to learn this, get some money for it, right? I was working all the time. I didn't have time for my friends anymore. I didn't have time to have fun. And I no longer got a guaranteed allowance from my parents because I had to show up on the job and do everything I said I was going to do as part of my employee contract. So I realized right away that this is what I'm going to be doing for the rest of my life. I had to adjust accordingly, but it was a new way of thinking because no longer was I getting money for doing chores around the house or just being consistent with things. This was based on my performance, how I did well at the grocery store, not just bagging, but how I treated the other customers or how I went around and helped the other checkers that were there. I had to do a lot of different things and it was very time consuming and it took a lot of time, even though I was only working 20 hours a week. So I tell you that stories because I think that's very similar to what's happening in value-based care. A lot of primary care practices specifically, right, see the opportunity. Right now, they're probably doing, or we're doing fee for service, but it's becoming more and more complicated. But it was guaranteed money. You did a job, you got compensated for it. Well, Centers for Medicare and Medicaid Services came up with this great plan of value-based care. And this model is all about making sure that you get compensated for outcomes. And that's great in theory. So a lot of practices say, hey, you know what? I could probably potentially get more money if I go to these value-based care programs because they do things like pay for performance. So if patients get better, you get incentives. And so they said, this is going to be a better pathway for us instead of doing a fee for service because obviously what's happening, fee for service models are going down. We're not seeing as much reimbursement for that. And so a lot of private practices, medical practices, who deal with primary care specifically, and even some of those specialties we've seen in nephrology, we've seen in cardiology, decide to do this value-based care models. The challenge has been you don't have all the information as a primary care. And so you're struggling trying to figure out how you're going to implement this, right? Because it's very complicated. You have to understand the contracting, very detailed oriented. You need to understand what patients are going to be in these type of programs. You understand what you're going to evaluate. You need to understand how to get the data that determines if you're doing value-based care properly. Basically, are you getting outcomes that you promised the payer, right? The payer is only going to be in a value-based contract with you if you have data that shows them that they will not have to pay as higher costs because you're providing better care for that patient. And ultimately, that data is key. Make sure you get the right information. And because healthcare is not intertwined, as we all know, interoperability is still an issue, it may be difficult for you to get all the necessary data that you can and get the interventions that will prevent the patient from going to the hospital, which is a huge cost driver. Some places, an ED visit can cost as much as $10,000 for a payer. So this is something that a lot of practices jumped on board, but not really understanding all of that, right? For instance, I've talked to several different primary care practices practices. One primary care practice I spoke to, they signed a value-based contract deal. Well, first they had a vendor that was doing all this for them, but it was non-transparent. They had no visibility into their payments. They had no understanding of how things were flowing through, and they just were struggling because it's like, wait a minute, I'm doing more work, but I'm not getting paid more for what I'm doing. And that was always a head scratcher for that physician. And the other challenge was they signed a 3-year contract with this vendor in order to provide the data they needed for these kind of value-based care programs. It kind of makes sense, right? Because if a third party's coming in to handle your patients, there's going to be a lot of costs up front, right? To kind of manage that process, set up the data structures and all that to provide best quality measurements. But the challenge is going to be after that first year, they have more stability. So they want to lock you into a longer contract because that total contract value for that patient increases every year. Because the upfront cost is basically what you have to pay. But once those are done, then now the revenue and the reimbursement is there for the third party. So that's why they want to lock you into these long-term contracts. And it can be frustrating for a provider who's seeing their money go down, even though they're doing maybe more work because of this contract arrangement. Likewise, I saw another primary care practice. One was set in the DC area, one was set in the Georgia area. They signed a contract, and it was right around the time when the hack just happened, the Change Healthcare hack. And this is a hack that happened where the payments were all kind of messed up anyway, right? People weren't getting paid for different things. And so when you switch over to these kind of value-based contracts, the money just wasn't there. It was an issue with them receiving reimbursement. And for the first time, there were gaps in payment. And so they have to dig into savings to help cover the shortage. And that's a challenge, right? And so I think a lot of primary care practices, they need to understand, or anybody who's going to a value-based contract needs to understand the economics at a level that maybe they haven't thought about it. So when you think about the models when it comes to value-based care programs, there's all these different models, right? There's the shared savings programs. These are like programs that are set in stone, like similar to accountable care organizations, where if you have an opportunity where you save money, then you get all the upside, right? And so those are great. Basically, you get a set rate, which is okay, but then you get all the upside if you provide the savings. And a lot of practices love that. Upside only, right? No downside risk. Then you have bundled contracts, right? So these are known entities. For instance, like a surgery, a knee surgery, right? So basically you could say, hey, I have a process as a surgeon to help manage someone's knee and the surgery that goes into it. So look, you bundle this payment into one fee and then you pay me for that bundle. And basically, as long as I provide the service below what you're paying me, then basically I made a profit. And so bundle payments are easier because you can structure it better from a financial standpoint. Shared risk is another one. That's hard, right? That's the one where there's a downside and an upside. And so basically, if you don't achieve these objectives and there's no savings there, then basically you would have the payer or insurer that's in this contract with you will be asking for money back. But vice versa, if you are aligned and are getting the reimbursement, are getting the savings for the payer, so ED visits are down, patients are staying healthier, they stay out of the hospital, lower costs overall, you save in that benefit. And so a lot of practices love that, but that's the one you really have to understand clearly. And last but not least is capitation, where you're basically looking at a set fee per patient per month. And if you can manage that, then great. The problem with that is a lot of times your patient mix that you're trying to partner with the payer on, it can be all over the place. And if you have sicker patients in this patient mix, then your per patient per month cost is going to be higher than the reimbursement you're getting in this capitated rate, because that's all you're getting. You're not getting anything more or less, right, for that. And so the challenge I see is with a lot of organizations going into these programs thinking it's going to be all this, right? But they don't set it up right. So number one of the best things we've been recommending to some of our clients is actually bring on actual mathematicians called actuaries. These are individuals that are able to use the math to understand the modeling better, to really clearly understand how to structure a value-based contract. You probably want an actuary actually in the negotiations when you're starting this process. So basically you have the data. You can start understanding the benchmarks of exactly what it costs you to deliver service to a patient, and then have an actual blessed so that when you are in these contract negotiations with the payer, they're able to have better conversations because now you have something that's actually sound, right? From an actual actuary. These are high-level statistical analysis of understanding what is this model, what's the cost that it's going to cost you to deliver this care, and what's the savings, and then it can be modeled out over time based on different patients that the payer may want to give you. So this is something that I think a lot of practices need to kind of invest in and go into. And there's some startups now that have models like that. Secondly, you want to partner with vendors, right? Vendors like myself and some of the things we do with remote care services. Basically, that helps you with interventions. You also want to have third parties that help you with the data, because reporting is so much. There's a lot of reporting. A lot of times this is monthly, quarterly, and keeping up with it is difficult. But it can be a lot easier if you have the capabilities and you have the right vendor partner that can put that together for you. And more importantly, having a consultant that can help you walk you through the whole process, right? So you can have that structure in place. So basically, you want to make sure you have a way to capture data effectively, way to report it effectively, so it's not overly burdened to you and your staff. Next, the interventions. You want to make sure you have software to help with those interventions that can help you get those savings, right? Because that's really going to help the bottom line. If you can provide resources and opportunities to keep the patients out of the hospital or out of ED visits, or keeping patients healthier and out of situations where they're raising up costs, right, for additional medications and things like that. If you have software that can do that and can help with that kind of remote care type service, you're absolutely going to lower the cost of care, because think about it, the patient's not actually using a mid-level or even your time to have that conversation. And typically your time is at an hourly rate that's a lot more expensive. So having someone that does the interventions, understands that part of it piece, the data piece. And the last piece is your overall team internal. You need to understand how to structure the team. So a lot of times there's going to be a lot of gaps in care. You got to transition from the old way of delivering service to this new way, and having team members understand that. A lot of times that's just about bringing in individuals that can train your staff in understanding how to deliver value-based care. For instance, we work with several partners that go in and they actually teach nephrology practices on how to deliver value-based care programs. They actually go and train them in understanding the needs to get the data collected, the understanding of the models, to clearly walk them through every step of the process to make sure they understand how they're going to meet the requirements for the kidney cares or the CKCC program, right? That's required for nephrology. And they're seeing great benefits there. Again, nothing wrong with these value-based care models. It's just something that all practices should go with the eyes open. But if you really feel like this is the pathway you want to go down, and absolutely, this is where it's going. Let's be honest. There is statistics that say, or CMS has put it out there, by 2030, they want to get 100% of Medicare patients on some kind of value-based care program, because they've seen the numbers, right? They crunch the numbers. They know this is the pathway for healthcare. We can help incentivize practices and providers on better patient outcomes, then the cost will get lower and it will help healthcare overall, which we all know is huge burden. 20% GDP, something like $7 trillion that's hitting us right now when it comes to healthcare opportunities. So these are things that you need to be aware of when you get these value-based care programs. Again, look at, before you jump on anything, you want to make sure you bring in consultants that understand the actual sciences, the actual data tables, to look at the information and understand exactly how the model is going to work. Next, you want to bring on board vendors that can help you with the data collection, understand that process. Then you want to bring on the vendors that can help you with interventions, remote care programs, or remote patient monitoring, chronic care management. All these programs help reduce the cost of care to the patient populations. Third, you want to make sure your team is trained up and ready to deliver this at scale, and having someone that can help you walk through that process. If you kind of follow these steps, I believe absolutely that you can be successful in structuring your value-based contract successfully and be on the right path of where it's going in the future. So hopefully you like this. I have a ton of data and information around different areas when it comes to healthcare. This channel is all about making sure you're successful in a new model of healthcare. So go check to the left of me and click on anything else you want to know about remote care, understanding clinical studies, understanding AI and its place in healthcare. We have tons of videos that's going to help you in this new normal of healthcare.